Welcome. It is that time, Friday, 12 p.m. Eastern Time for Ask Dr. Geier Live. Wherever you're watching, hope you're making today your masterpiece on this really cloudy and rainy day here in Charleston, South Carolina. I hope wherever you are, you're having a fantastic day. I'm Dr. David Geier, double board certified orthopedic surgeon and sports medicine specialist and media medical expert. I hope you feel and perform your best regardless of age, injury, or medical conditions, medical history, whatever it is. I am here to help you. And today is the day that I answer your orthopedic questions, injury, surgery, recovery, rehab, whatever it might be. Please remember, this is not meant for medical advice in any way. This is meant for education and informational purposes only. It is intended for you to understand the situation a little bit better, maybe get it translated into English if you don't understand the terminology, and then you can take that information to your orthopedic surgeon or your doctor or your physical therapist and say, hey, what about this? It is not by any means me telling you what to do. Also, if you want more information on how to see me in Charleston, South Carolina, the information is below in the description down there. We are only on YouTube on Fridays. In case this is the first time to us, leave your comments in the chat, leave your questions, whatever, in the chat, not in the comments, because I can't see that. All I can see are the chat messages in Restream, which is what I use to send this out to various social media. All right, first question today, Muhammad, 5 months post-op ACL, using hamstring and meniscus repair, still having some pain when you activate quad, extending my knee. I usually discomfort after an ACL is related to not getting all the strength back, and that can take a long time. You want to try to get most of that back by 3 months or so, but some people can take longer. That may be more time in physical therapy, more work with, at first it may be just body weight leg presses and squats, and then you get to, or not body weight leg presses, but body weight squats, wall squats, things like that, leg presses, but trying to co-activate the quads and hamstrings until you get strong enough to do single-legged things. Maybe you get strong enough and far enough, well, you're probably far enough out now, talk about things like leg extensions, things like that. Short of that, if there's something else going on, which is possible, the meniscus repair, if it was actually a repair where they sewed it back together, maybe that didn't heal, that kind of thing, and sometimes an MR arthrogram can help identify that kind of thing. All right, Demont Dokken, I may be saying that wrong, and I apologize. Grade 2 ankle sprain, dorsal bone marrow edema, does it heal with physio or need surgery yet? No, again, I'm not telling you in your case. Ankle sprains generally heal. Grade 1, grade 2, grade 3, lateral ankle sprains generally heal without surgery, and the bone bruise should resolve without surgery. There are some indications sometimes where ankle sprains would need surgery, such as if it created an osteochondral defect of the talus. There's a couple other scenarios, but that would be at least what that description is. Generally, that is something we talk about rehab. That's one of the challenges with ankle sprains, and seeing as I don't have any other questions here, I will do this for a minute or two. Just realized my mic is in the shot. I don't like that. I was recording something else before I started this and had to move the mic. One of the challenges with ankle sprains is that most of the time, 80, 85, 90% of the time, you do very little, it gets better, especially the mild ones. The trick is the people that come in 6 or 8 weeks later, 3 months later, still hurting. And it's usually one of two things. They haven't rehabbed it well, and a lot of times that's where physical therapy can get people a lot better than just giving it time on their own. And then two, or the diagnosis is wrong. It was an ankle sprain, but there was also some kind of other injury. Like I said, osteochondral lesion of the talus, or a high ankle sprain component, or a stretch of the superficial peroneal nerve. There's a lot of other things. So those would be things I'd think about if somebody has ankle pain many weeks, months even after an ankle sprain. Those would be the kind of two things I'd think about. Muhammad said they stitched and trimmed apart scar tissue. Yeah, typically meniscal repairs, assuming they took the entire part of the tear out and just left the stable rim, that shouldn't be an issue. Repair, which a lot of people think they have a meniscal repair surgery, 85-ish, that's not a perfect number, but most of the time in adults, that's actually not a repair where they sew it together with stitches, that's trimming it out, which is what he's talking about. Assuming that doesn't usually typically lead to, very rarely at least, doesn't lead to any need for further surgery, because you take out the torn part that's causing trouble. There's nothing that actually needs to heal. Could there be scar tissue? Potentially, not so much from the meniscus, but you can develop scar tissue in front of the graft, in front of the ACL, the new ACL. Typically, the issue there is not pain so much as loss of full extension. Not always a perfect, but that's usually what it is. All right, it looks like that is all we have for today. If you want to see me in Charleston, South Carolina, again, my website is in the description below this video. Very, very much appreciate it. You are so welcome to mine. I'm more than happy to see you here in Charleston, South Carolina, and talk to you about all your options, not just cortisone, physical therapy, and surgery. Very excited to have you here today, and I look forward to seeing you every Friday, 12 p.m. Eastern Time, or most every Friday. Look forward to seeing you again next time. Take care.